Becoming a doctor anywhere in the world takes tremendous effort and years of preparation. In the U.S., it is one of the most demanding and competitive fields. As challenging as it is for native-born Americans to practice medicine, the path to becoming a doctor as an immigrant, even for those who are seasoned medical professionals in their home country, poses an even more substantial challenge. Many states across the country face shortages of medical doctors, yet thousands of foreign-born doctors who could meet the needs of these states face restrictions that prevent them from using their life-saving skills to expand American healthcare capacity. We spoke with foreign-born doctors to learn about their journeys to come practice in the United States and what changes in the immigration and healthcare systems are necessary to maximize their potential in making medical coverage available to more Americans.
I'm Lawrence Gostin. I'm professor of global health law at Georgetown University, director of the O'Neill Institute for National and Global Health Law, and director of the World Health Organization Center on Global Health Law.
My name is Ruzbek Rasadi. I'm a MD, general surgeon / hepatobiliary.
My name is Oscar Cepero. I've been practicing in the U.S. for 20 years. I came from Peru.
My full name is Makbul Halatpura. I'm a medical oncologist. I currently practice in Scottsdale, Arizona.
I'm Matthew Colkin. I'm a partner in the firm of Colkin & Colkin. We have a focus on deportation defense, but we have a full spectrum immigration law practice.
All my family are teachers and been for years, and then all, as a teacher parent, they want their kids to be the best in the class always. So we were naturally the best in the class. And back home and even here, when you're best in the class, a couple of things that can happen. You can become a doctor, or you totally lose your interest in everything and become rich. And I became a doctor.
I immigrated from Pakistan. So I come from a family of physicians. My father was a physician himself. My stepmother was a physician. 3 of my elder brothers are physicians. 3 of my actually sister-in-laws were physicians. So I grew up pretty much in that environment. So medicine was in my blood.
My mom was a social worker at a very early age. I'm talking about 12 years probably. I used to go to the hospital with her. In those years, nobody checked. I was allowed to walk with her through the hallways of the hospital. So I think I have a great exposure, visiting a hospital, seeing patients, seeing how my mom was helping people. And, by the time I was 14, I knew I wanted to be a doctor.
Well, there's a push and a pull. The push is because in many parts of the world, they have very low pay. Their families are not secure. They can't get a good education for their children to the best of their ability, and so that they're drawn to other countries. The pull is that they like to come when they can to a highly developed country. Among the most sought-after destinations is the U.S.
Well, the free market is the draw. The salaries that you can receive as a medical doctor in the United States, from the statistics that I've seen, far exceed those in other first world countries.
In fact, 2 of my elder brothers who are physicians live in England, and that's where I wanted to go to. But one of my elder brothers, he's a retired GP, he was a general practitioner in London, advised me that America was the future and England was kind of not where things are going to be. So he was very instrumental in encouraging me to come to the U.S.
So one of the things that always amazed me is the technology here. So, I knew I want to come to the U.S. because, that's the way you can practice medicine. In my country, we improvise a lot. We're very good improvising. But, it's frustrating when you cannot do enough for a patient. I felt like in the U.S., you will have everything. Well, lately, I think we're wrong because we see that in the pandemic and this country was not ready. And it's not fault of federal government, it's fault of every single government in the last, I would say, 15 years. Because we have several pandemics or pandemic things and, nobody was really prepared.
If somebody is, coming to a foreign country, but they're also having to pay for their education or residency, and they're having to work odd hours. We all know that doctors and nurses work horrific hours, and they also, particularly with COVID and other health emergencies, they're stressed to the max. Even domestic doctors are really, we call them heroes, and they are. And so if you can imagine having then to also do a second job, and the second job just might be, janitor or cleaning or, something that's, way under their skill level. It's demeaning, it's expensive, it's exhausting. And, if we want them in our system, we have to make it possible for them to succeed.
So it's a challenge. It's a step back. You have to, you've been through the internship and the residency. I'd only done that for 3 to 4 years. I'd actually, taught in Pakistan, and from being a teacher and being respected as a fully trained physician in your specialty that people look up to, now you have to start from scratch again. And a lot of times what happens is that when foreign physicians come here, they cannot and they do not get an opportunity in their own specialty that they have actually, invested years of training.
It's difficult to get in and it's difficult to proceed and progress because you have to be 10 times better than anybody else. First of all, I believe this is a great thing for our society to be exposed to different cultures. And I think what makes this vibrant and competitive and actually better in terms of every aspect you look at it, competition for residency, competition for fellowship, everything, is that you have different talents that you absorb from all over the world for free, pretty much. They train, somebody else train them, you get them, and then you train them as American, which is great. But at the same time, you have to let them get visa, let them be equal in terms of entry, but then be tough on them on education, make them work harder, make them get better scores. I'm okay with that. But the system should let them come in first before we decide on that.
Going through medical school and going through training is hard enough once in your lifetime, but to have to do it a second time, it's literally like, being crucified more than once in your life.
Immigrant healthcare professionals play a really important role, not just healthcare professionals, but also ancillary staff at hospitals and other places play a major role. They fill gaps. They also provide, a greater doctor or nurse per patient ratios in hospitals and states, localities, cities. And, in many cases, they provide, a culturally appropriate way to make patients feel comfortable, linguistically, culturally. There will be patients, that look like them, speak their language, and so they can be, they can connect more to certain patients who may be immigrants themselves than an American trained doctor. So they have very important roles to play, and we need to respect and pay for them.
And the reality of the situation is, especially if you are trying to find a specialist in this country, there is a tremendous shortage of qualified individuals. And Congress needs to act to provide a streamlined method for physicians who are from designated schools that the United States Congress and Department of Labor have already pre-assessed as being the equivalent of a United States university, for them to be able to show their degree and simply apply for employment authorization and a visa to be able to come to the U.S. And as long as they can establish that they are employed for that university, they should be able to self-sponsor.
Imagine if you're a med student, you finish school with a debt around $400,000. So today, there's not too many people interested in going to med school, because when you graduate, it's like paying a mortgage. So the beauty of this country is that it still can attract people from other countries. But I feel like, there are so many regulations in immigration that, this country doesn't take the advantage of a lot of people that they want to come here, qualified people. I'm talking a very selective immigration. The federal government doesn't know exactly the needs of a state. The federal government authorized X amount of thousands of visas, but you need to know more. You need to know how many internists you need or how many surgeons you need. You might be in a community where they need more pediatricians and you're bringing surgeons. The states still have the shortage. Well, they can be enough doctors if they change the regulations, if they change the way they attract people here. Because let's say Idaho, they might need pathologists. So they will help people to immigrate to do pathology. I think that's a good opportunity to supply the need of many, many states.
And even let's say we have enough doctors, why don't we open to competition? Why don't we want to bring our system and our knowledge and our doctor training down because we want to just get from our own? Why don't we open to excel this program and make our people get better too, and do like in professional athletes? Do we say you're from that country so you cannot play soccer here? No, we buy them and say, okay, compete. Who's best goes to that team. We should do the same thing. Why we are saying no? We want to get the best care for our patient, not the best color or race.
So I would say that the immigrant community is essential to the healthy staffing of our healthcare system, and that, to use another medical analogy, we would be crippled without them.
Of course, we have to have smart immigration policy, and we don't want open borders or anything like that. But we want to be able to recruit and retain the best and the brightest in medicine, in science and technology, all of those areas. We shoot ourselves in the foot. We might, we might have somebody from China or Latin America or something who is brilliant, come and, get a PhD from, Stanford or Harvard and, or Georgetown, where I am. And then, and then we send them back home. It's insane not to be able to have an immigration policy and laws that really accommodate the kinds of intellectual capital that the United States needs. And that may also mean that we need to be compassionate toward their families, because people are not going to come. We tend to kind of think of immigrants as the other. But in truth, how would we feel, if we went to another country and either we couldn't stay or we couldn't bring our families over? We wouldn't feel very good. So, the best way to kind of think about these kinds of policies is to, for God's sake, just put yourself in the position of the other person. That's not a political statement, but we've really politicized immigration in a horrible way.
Like doctors in the United States, people around the world go into medicine to serve others and make their communities healthier. Doctors that want to come and practice in the United States are not a threat to our healthcare system. In fact, they benefit it. To learn more about immigrant doctors and the roles they can play to strengthen our healthcare system, visit cato.org.